Now we have two more sessions. Finally, we have one last keynote session presentation, which will be by Dr. Saurabh Chandra, Chief Telehealth Officer, University of Mississippi Medical Center, USA, and Future of Telehealth in the Post-Pandemic Era. Thank you, Dr. Saurabh. Can you please take over? The stage is all yours.
Yeah, can you hear me?
Yes, we can. We can hear you.
And are you able to see my slide deck?
Yes, we can see your slides.
All right. Good afternoon, and thank you for the opportunity. The topic for my presentation today is Future of Telehealth in the Post-Pandemic Era. I think we saw the increased exponential growth in telehealth during the pandemic, and probably that's one of the reasons that we are all talking about telehealth today in different settings. But the question is how to sustain the momentum. Where should we go from here moving forward as we move into the post-pandemic era? And thank you for giving me the opportunity to share some of my thoughts. I have no disclosures. And just before I enter, the heart of my conversation today, just wanted to remind the audience of the different modalities that come under telehealth. The telehealth is usually associated with audio, visual, audio, video, live, synchronous modality, but it's more than that. They are store and forward capabilities. For example, if you have a lesion and you take a picture, send it to your dermatologist, they do a reading consultation, send it back their opinion to you or your physician. That's store and forward. You have mobile health apps that are on your devices, provide educations. And then a very exciting branch that is remote patient monitoring that allows patients' biometric data, vital signs to be collected at home, gives a lot of information in their home setting and allow medical management of their conditions at home. And there are a lot of benefits of telehealth. I put it in 4 buckets: benefits for the patient, benefits for the provider, improve clinical outcomes, and improve financial return on investment. So just wanted to give you a little bit of history of our Center for Telehealth at the University of Mississippi Medical Center. We were early adopters of telemedicine just because Mississippi is a predominantly rural state, is a large state, and the population is dispersed throughout the state, and there have always been problems with access to healthcare. So we were early adopters for telehealth when people didn't even know what telemedicine stood or was defined as. And so our program started way back in the 1990s, early 2000s. And then we were designated as a Center for Excellence by the federal government in 2017. And in 2021, we just got redesignated as the Center of Excellence. We are one of the nation's 2 centers of excellence for telehealth as designated by the federal government. So we saw, just like anybody else, other entities, an exponential increase in the utilization of telehealth in the 2020. And the question is, how do we sustain that? This is just a slide showing, the utilization by Medicare beneficiaries in 2020. Almost 40% of the beneficiaries reported utilizing telehealth. There was another report by AMA, American Medical Association, in March of this year that shows that almost 85% of the physicians reported as having used telehealth. So how do we go? Where do we go from here, and how do we achieve our collective mission of sustaining the growth of telehealth? And we sat together at our center, and I wanted to share a framework that we have developed for sustaining telehealth in the post-pandemic era. And so telehealth, one important thing is that telehealth should not be considered as a modality that is functioning in silo. It should be integrated in existing care delivery models. It should be part and parcel of when anybody is creating a healthcare strategy, you should be thinking about how telehealth can be incorporated in your healthcare strategy. It should not be a separate strategy. It should be integrated. And there can be a hybrid model. Some patients have been seen in person, and then as appropriate, they're being in telehealth. So that is something that everyone should always consider, that it should be integrated. It should not lead to fragmentation of care. There are a lot of concerns about, again, patients being seen in by telehealth, by providers that are not their primary care providers, and then primary care providers have no knowledge of what the patient, that the patient was seen by specialists, and what happened to their care. So there should not be fragmentation of care for the patients. Then it's only when you'll achieve the best outcomes for the patients. You should identify gaps in existing care models, and the net result should be enhancing care and not just substituting care. And it should create and demonstrate value for multiple stakeholders, whether patients, whether providers, whether administration, policymakers. They should be. You should always think in mind how it is creating value for all stakeholders. And then it should actually provide care across the care continuum. And what do I mean by care continuum? What I mean by care continuum is that telehealth should be incorporated in all settings. And all settings is where the patient receives care: home, ambulatory, acute care that is in the hospital, post-acute care that is in nursing homes, all types of care. You can have preventive, you can have acute incidents, maintenance, also can be supported by telehealth. And for all age groups, everyone should benefit for telehealth, whether they're kids or whether they're adults or whether it is the geriatric population. And I'm going to give you some examples of that. And this is a very busy slide, but this actually represents how you should be thinking about telehealth in the post-pandemic era, when there are loosening of regulations. We hope some of them are maintained after the PHE ends here in the United States, enabling us to provide care to every age group wherever they receive their health, whether it's home, schools, a primary care physician's office, or hospitals, identifying gaps in care and bridging those gaps in care by using telehealth. For example, for the pediatric health, if you're at home, think about providing urgent care, behavioral health, remote patient monitoring for chronic disease management. Important aspect for school. We are here implementing one of the largest school-based telehealth programs in the United States in Mississippi. Think about providing urgent care, behavioral health, and other preventive programs in school. And of course, there are specialty consultations, access to specialists, inpatient consults, NICU, PICU, cardiology, neurology. So understand what is your gaps that you're trying to bridge to telehealth, and then using telehealth to bridge those gaps. Same for adults. Home, whether you are in primary care physician's office, you can have direct consultations there. And then inpatients, you can have tele-stroke, tele-emergency, tele-ICU. I'm going to skip some of these slides. I think we are running behind time, but this is what I want to focus in the post-pandemic era. Think about what, number one step, think about what is the right clinical program that you are targeting. What is the right clinical program for your patient population? And then the number one step is creating the right team for that, whether it is tele-urgent care, whether it's a remote patient monitoring team. Create the right team for your clinical program. How do you, sorry, I'm going the other way around. I'm skipping this. How do you choose your right team? It could be part of your own health system, but telehealth has shown us that your providers don't need to be part of your own team. They can be anywhere, they can be part, and you can collaborate with other health entities. And this is all about getting access to providers. State boundaries don't mean anything. State regulations are important, but for telehealth, you can provide services if you meet the regulations from anywhere. So think about whether you have the bandwidth from your own team, or you need to collaborate, you have shortage of providers, and this is an opportunity for you to collaborate with outside entities. This is showing a slide on a collaboration that we in New York, when I was the medical director there, during the first wave of pandemic, we collaborated with the health system in Northwest, in Seattle, for the patients, for the team at bedside. It didn't really matter who was coming through the camera, whether it was the provider sitting 10 miles from them or 1,000 miles from them. Great opportunity there. Think about whether you have your own bandwidth or you need to create bandwidth by collaborating with health systems. Very important part, selection of telehealth platform and integration with the EMRs. A big focus should be, what is your long-term digital strategy? What is your platform? Is it 5 different platforms for 5 different programs, or one platform that is integrated with your EMR, provides all the information, collects all the information in one place? Very important to think about what is the platform that you're working. There are a lot of vendors out there, but selecting the right vendor, putting in a lot of energy into that will pay rich dividends for you in the post-pandemic era. And then, of course, data. We need to demonstrate value for everyone. We need to have good strategy for collecting data to demonstrate value for our telehealth programs. Here at UMMC, we are creating a telehealth data warehouse that will house all the data for different telehealth programs in one place. We are inviting other health entities around the country to share their data, so that all the data in the same format is collected and then can be utilized to do research and show benefits of telehealth to the policymakers, so that we can get reimbursement, we can have good policies for the sustainment of our telehealth programs. And I'm going to stop there and thank you for the opportunity, and take any questions that anyone has.
Right. So there are no questions, Dr. Saurabh, and I must thank for your time and sharing your impeccable knowledge on telehealth.
Thank you.
Over to you, Satish.
Thank you, Bridget. Thank you, Dr. Saurabh. It was definitely a very informative session. Thank you for joining us, Dr. Saurabh.